Hello my friends, after welcome to medical science class. As a student of medical science, I wanted to keep better in of medical science. What kind of things I do that is for the medical research that is very very as a customer was doing on indicators and all location last time. Now my friend was how much question by yeah alif lam yeah no chapter in case of fracture, we discussed elaborated about fracture memory. Any fracture dislocation. In case of any fracture and dislocation, for example, this dislocation. First, in case of this dislocation, first correct the dislocation. Then go to the rest. Give the rest. Elbow back. If fracture anything occur, then correct the fracture. Then first soft plaster, go to the X-ray. If correct, then go to the hard plaster and check the pulse. Pulse remain by pulse oximeter or pulse finger pulse. Check that in case of limb, finger pulse. In case of elbow, brachial pulse. In case of leg, finger pulse. Thigh, we check the artery there. And in case of thigh, we check the popliteal pulse. And in case of leg, we check the artery of Brussels penis pulse. And in case of foot, finger pulse. What is the reason pulse? If blood circulation obstruction, then necrosis occurs. In case of necrosis, that is dangerous for cancer. That is the reason for if necrosis occurs, if blood circulation occurs, also the compartment syndrome. Compartment syndrome also occurs. That is the reason you check the pulse. Check the pulse, correct the management, fracture management. First correct the fracture, soft plaster and hard plaster. Then go to the check the pulse. If everything is okay, no problem. Just like that. That is the fracture management. In case of drug infection management, orthopedic pain, just give the painkiller and antibiotic prophylaxis. But antibiotic not reduce if this necessary. If open fracture, jam, then tetanus injection and dust. And if close fracture, then painkiller. Just painkiller and painkiller and pain management and just pain management and fracture the calcium and vitamin D rich food. Calcium and vitamin D rich food and calcium and vitamin D. Just nothing else. Fine. Now my friend Professor Potter. In case of medical physics, how manage the fracture? In case of knee. That is for my knee question. I also try for my hand to correct that by medical physics. In that occasion, dislocation, fracture is not correct, fracture correct, but there is a deviation or there is a fracture deviation and there is a union occur. That not main union, that is the looks not look like that. And if you see that there is a defect in the hand. You are correct. I tried for medical physics. In case of medical physics, how we correct that? Already joint is already the joint is correct, but there is a dislocation or there is a disunion. Union is not smooth and good. Union is not smooth and good. For that reason, I tried for medical physics, solve the bone cell, and tried for correct that solve the bone and tried for correct that. And in case of medical physics, how fracture is correct. With fracture, okay. If close fracture, first go to the correct the fracture and the union of bone close together and give pressure and give energy. By energy, bone is fused, then withdraw the energy. For example, give the heat. By heat, bone is, for understanding purpose, by heat, if you give the candle, what happens? Heat candle is reduced by just like that. Give the energy. By energy, bone is soft and withdraw the energy. Bone is, when bone is correct, give the energy. Bone cell now soft. Then withdraw the energy. Correct. Just like you mentioned. I also try for that and research for that still now. And my friend is after medical physics in fracture management. Still now I try for that. This is 2 lakh patient. 2 lakh patient, how you do that without me? You try. Their union of. Is it possible? Okay, fine. If you give risks, I go. Okay, fine. If union is correct, soft cluster given. Soft cluster given. Yes. But how can I give energy? Okay, fine. Just like Allah Shafi, Allah Mafi, Allah Ka. Wait 1 minute. Then now you see that by medical physics, just within a minute, after 1 minute you see that bone is union is okay. Take a X-ray. Bone union is good and everything is okay or not, and look like normal. I not take any risks. Those patient that takes next and doctor, that is doctor also not take. Those patient let me as a doctor and respect one of doctor they come. After 1 minute, wait and see. That is medical physics. How fracture correct. In case of fracture correct, maybe 3 months, 6 months. In that policy, just within a minute correct the fracture. Try for within a minute correct the fracture. Take the picture, take the X-ray. Everything is okay, correct. Now soft cluster open. Now you soft cluster open the soft cluster. If everything is okay, X-ray show the normal. Soft cluster open. Just give a elbow back and rest. Keep rest on it. Not weight lifting or anything weight. After. But I also try for me. It's not work. Why not work? I don't know. My union, in case of bone, there is a dislocation or the correction is not smooth. That is the reason I try for the physics, solve the bone and correct to smooth this sharp and smooth. Still now I try. That is enough to prove that I am also creation. That is enough to prove I am also creation. That cut, there is a scar mark and cut injury, sign of injury of cell. That is enough to prove that I am also creation, a simple creation of the Allah, nothing else. My friend was after one and only creator, ALLAHU created me, can change, can guide, can control, can destroy me forever. Thank you very much, my friend. By in case of medical physics, already say medical physics royalty 10 lakh taka and medical chemistry 5 lakh taka, medical chemistry 5 lakh, medical physics 10 lakh royalty usually. Then that depend on me and patient usually. Thank you very much my friends.